All right, talk about the Ebola virus is everywhere. According to the World Health Organization, this outbreak is the worst in history and has nearly doubled the number of cases of deaths since the second worst outbreak in 1976. And more than 1,300 people have contracted Ebola since March. Now, the big question many of us are asking, can I get it here in the U.S. and how does it spread? Our medical expert, Dr. Campbell, is here to answer those questions. So let's get straight to it. What is the Ebola virus and what are some of the symptoms?
So Ebola virus is a virus that is transmitted through body fluids and contact, not casual contact, not through the air like flu or SARS or MERS, but you have to come in contact with blood, urine, feces, or other bodily fluids. It is a virus that can cause very high fever, body aches, fatigue, and then some GI type symptoms as well. So it can mimic a lot of other diseases, but it can become quite severe and life-threatening.
Right, and the fatality rate is very high, about 90%?
That's exactly right. If you take all of the outbreaks from 1975 forward, 90% is the number. The current outbreak is about 60 to 65% fatal, but it is a very, very lethal disease.
Okay, and how is it spread? I know you talked about bodily fluids, but why such a huge outbreak in Africa as well?
You know, it's interesting. A lot of this has to do with cultural practices. In Africa, it's particularly in Guinea, these folks care for their sick themselves. They don't isolate themselves. And there's some burial practices when these patients pass away that they clean the bodies. And so they come intimately in contact with lots of body fluids. And that's why these outbreaks are so huge. And in the U.S., that just would not happen. Right. We would make sure of precautions for contact so that we would not pass the illness along.
All right, and we have a couple of the victims of the Ebola virus in the U.S. right now. Tell us more about that treatment, and is there a cure for this?
Right now, there is no cure. This treatment is completely experimental. It's made by a company that's out in San Diego with 9 employees, and it's in cooperation with some other large companies with the North Carolina tie, like we talked about. This serum is made up of proteins called antibodies, which can fight the disease, and it has made a miraculous difference in these 2 patients. However, we don't really know what the long-term or short-term side effects are. We need large clinical trials. The other challenge is, how do you get this serum produced at a level where we can get it all to the Africans who need it?
Good point. And these the people who have the patients right now who have the Ebola, they are in strict isolation right now. But what are the risks to the rest of us here in the U.S. of contracting this?
I think the risk is quite low. I think the chances of seeing an outbreak of Ebola here in the U.S. are quite low because we have the most advanced isolation protocols in the world. And these units in Emory, where these patients are being cared for, are just state of the art to keep us, other people caring from them, from contacting them and contracting the disease.
Dr. Campbell, thanks for shedding more light on that. Definitely a lot of people talking about it. Do you have a medical question for Dr. Campbell or another question about Ebola? Ask him. It's easy. Log on to our website to WNCN.com. Search links we mentioned, and from there you can find Dr. Campbell's website, or you can like his Facebook page and Twitter.